In recent years, the subject of mental health has become an area of high debate and attention. As teenagers during this era that have experienced our share of opinions on mental health, we decided to take a further look into how the subject of mental health is handled in the United States versus in Switzerland. As teenagers in a political climate that is changing drastically, the way in which the country handles the healthcare system, specifically the mental health field, is something of very important value. We will look at the variety of outlooks on mental health in the US as opposed to Switzerland. First will be Isabel Matthew, detailing how accessibility to mental health services are in each country. Next would be Aiyana Williams, presenting how schools in the US and in Switzerland will handle mental health. Following Aiyana will be Akilah Jones, explaining how the aspect of mental health is viewed by certain groups of people in the two countries. And finally, I will conclude the speech explaining how political figures in each country have taken stances on mental health and how they vary. Up first is Isabel Matthew.
Hi, my name is Isabel Matthew, and I will be discussing the general access of mental health services between the United States and Switzerland. Switzerland can be seen as utopian to the general public compared to the United States. We all know that healthcare in general has been a touchy topic, especially nowadays. Healthcare and everything related to healthcare is something that you can't keep out of your mouth. But while it being compared to Switzerland, the United States, and its treatment towards mental health is not really winning the race. Think about the last time before COVID you attended a doctor's appointment. It was pretty easy to schedule, right? While under the right insurance, it does not seem to cause much stress. Most citizens in the United States aren't provided with such luxury of a fulfilling health insurance plan, let alone one that grants access to optimal mental health care services. We need to understand that to access these mental health care services, it is not as easy as just walking up to the door of the psychiatrist and being helped right on the spot. There is a middleman, and that middleman is health insurance companies. So when we see media cover the news stories and the events regarding healthcare in itself, it's really the healthcare insurance plans that are causing the problems financially. In the United States of America, healthcare insurance plans are based on individual factors. So for all the millions of citizens in this country, there's no one fixed health insurance plan for all of them. Usually, it is dependent on what the employers pick for their employees in terms of their health insurance plan. Unfortunately, it cannot be expected for all companies in the country to provide luxurious treatment plans such as acupuncture or top-notch dental treatment, low deductible costs, let alone full coverage on specific services such as mental health. Switzerland, however, uses a much more strategic approach towards healthcare for all compared to the United States. In Switzerland, they use a federally mandated insurance and is not supplied by the employers, nor do the citizens have to pay a tax towards the insurance bills. Everyone in Switzerland, including foreign citizens, are required to have health insurance. Meanwhile, in the United States, health insurance is not a requirement, and health insurance is only given to those who can actually afford it. Meanwhile, if you cannot afford it in Switzerland, local authorities will cover the expenses due to financial hardships. In the end, Switzerland is able to cover all of their citizens with healthcare insurance plans. With having that access to healthcare insurance plans, they're provided access to mental health care services. Meanwhile, in the United States, it's still a fend for yourself type of situation. According to a 2015 online survey of 5,000 Americans, 42% of the population saw cost and poor insurance coverage as the top barriers for accessing mental health care services. In Switzerland, however, that issue is not even brought up to them because access to insurance plans, and the costs are mainly covered by their insurance plans, which are given to them because they are a citizen of Switzerland. So let's say you are an American who has a decent health insurance plan. It grants some access to some mental health care services. However, with those citizens who are provided mental health care services, the cost of the services in itself must be decent enough for the patients to afford out of pocket. Imagine yourself hungry for lunch. You pass by a Panera Bread on your way home. You know that a Panera Bread meal would satisfy your hunger and meet all your needs. But then you realize that meal at Panera would cost $100. You can't afford that. And then you deem that too expensive and you decide to stay home, hungry and starving. That's how mental health is seen for some citizens in America. Because it is so expensive, it deters them from actually pursuing the services. While mental health has become much more of a popular topic in the recent years and citizens understand the importance of seeking help from mental health services, out-of-pocket costs are still the deciding factor of whether or not those citizens will pursue it. It is extremely easy to identify the difference between cost of mental health care services between Switzerland and the United States. According to an article discussing the Swiss mental health care system written by Dr. Schneeberger, 60 minutes of psychotherapy provided by a psychiatrist in Zurich would cost $260 in US dollars. Meanwhile, the co-payment for the patient would be $20. That is an insane difference and must be so beneficial for that patient. However, in the United States, the same service, the same 60-minute psychiatrist consultation would cost $269 out of pocket. You can see where the $20 versus the $269 out of pocket payments make such a difference. A mechanism for treatment for mental health is through medication. However, it is not news that medication falls off the trees. It is pretty expensive to acquire prescription drugs, especially in America. In fact, 1 month's supply of lorazepam 10 milligrams, an antidepressant, would cost a Swiss health insurance company to pay $50 for their patient. Meanwhile, the patient would be paying out of pocket about $10 for the copay. Keep in mind this drug is for the brand name. If it was for the generic, they would be paying as little as $2 for their copay. However, this is not seen in the United States at all. In the United States, the same prescription for lorazepam 10 milligrams could cost the patient about $250. And for the generic, it wouldn't even be that much cheaper, still $120 for the generic. The United States is notorious for inflating the prices of vital medications for its citizens. Why? Simply because they can. The United States has been built on the ideals of supply and demand, where if they see consumers needing something, they can inflate the prices for how much they want to gain profit because they know that these consumers cannot live without it. Unfortunately, that's how the United States sees healthcare. These outrageous prices are enough to deter a patient from seeking the correct means of treatment because of financial hardship, which is why some patients, some citizens will try and steer away from receiving correct mental care services because they know that the prices of pharmaceutical products could be out of their budget. People around the globe are beginning to understand the importance of maintaining mental health. However, the means of accessing these mental health care services is a whole different story. The two countries, Switzerland and the United States, both show how they prioritize healthcare for their citizens. For example, in Switzerland, Swiss citizens, even if they're foreign, are required to have health insurance. If they meet or encounter financial hardships, local authorities will even go to the lengths to support their healthcare. It's important for all their citizens to have their rights of healthcare, and it shows that the Swiss government cares about their well-being. For the United States, on the other hand, healthcare is not a requirement, and it's for those who can afford it. So if you can afford it, you get the healthcare insurance. Unfortunately, America is also leading in its poverty statistics, where a lot of families cannot afford the proper healthcare, let alone services for specific parts of the body, like mental health care services. It shows that the United States, it treats healthcare as more of a business before a provision of care for its citizens. So you can see how different Switzerland and the United States differ when it comes to healthcare and their access for mental health care services. Aiyana Williams will now take it away to speak about the access of mental health care services in a school setting.
In today's day and age, mental health is a major public health concern within the United States and Switzerland. It is important for local governments, healthcare institutions, and education systems to advocate for policies that allocate resources that are essential to flipping the frown upside down. According to the National Institute of Mental Health, only a third of youth receive effective diagnosis and treatment. Thus, the reason for promoting better access to care, because there has been an increasing need within the education systems and decreasing support in the accessibility of these health services. Today, I will delve into these issues and more surrounding the challenges of accessing timely and effective mental health treatment in school-based education and services in the United States. First, I will talk about promoting access to care through policy. Next, I will talk about the problem of youth mental health services. And finally, I will discuss the physician's role and the immense impact it can have on children if they are able to seek access to care.
I began taking notice on mental health within the Black community, starting within my family. I noticed when it came to my sister, before my parents took mental health seriously, they would usually shrug it off. This is when I realized that there was a lot of stubbornness behind taking mental health serious within the Black community. With that story being said, I will be discussing mental health problems within the Black community, as well as touching on the increased rate of depression and anxiety rising within the Black community. First, I will discuss how data shows how the Black community is more likely to experience serious mental health problems, as previously stated, being anxiety and depression. Next, I will discuss the stigma associated with mental health and the Black. I will explain influences that may affect Black people's mental health, as well as affect the stigma regarding Black mental health. The rise of mental health has been a leading issue within the United States over recent years. However, specifically within the Black community, there has been a significant increase of cases. According to the Columbia Psychiatry, the adult Black community is 20% more likely to experience serious mental health issues, where Black emerging adults ages 18 to 25 are reported to experience higher mental health issues, as discussed, being anxiety and depression. Leading on to my next topic, the rise of mental health within the United States has been a leading issue for many years. However, specifically within the Black community, there has been noticed that there has been an increased rise compared to other communities. According to the Columbia Psychiatry, the adult Black community is 20% more likely to experience serious mental health issues, where Black emerging adults ranging from 18 to 25 are reported to experience higher mental health problems with lower mental health service utilization. Leading on to my second topic, many Black people believe that having mental health issues is a personal weakness due to the negative stereotypes of instability and attitudes of rejection. Because of this lack of information about mental health issues in the Black community, it is not always clear when one may need it or when may need to find help. There is many issues with this. Because many people might not look and reach out for help, it is seen to cause an increase of incarceration rates for Black people. Many Black people who are incarcerated show signs of mental health issues. Similar to my second topic, although Black people just personally do not want to reach out for mental health because they're seen as weak, it also has strong relations to the fact that Black people are unable to access appropriate and culturally responsive mental health care facilities. Another reason why mental health is on an all-time rise within the Black community is because Black people face prejudice and racism in the daily, on an everyday basis. Moreover, given that the Black community exists at the intersection of racism, classism, and health inequity, their mental health needs are often exacerbated and oftentimes unfulfilled. When mental health is addressed in the Black community by acknowledging its rise and normalizing that it's okay to reach out for help, you will positively see effects on society today. The Black community has a long history of social change, and prioritizing mental health is not a sign of weakness, but an act of strength.
In recent years, as the subject of mental health becomes more normalized and more popular, politicians have often made the subject of mental health a topic of their platform on which they run on. Specifically in the United States, as the rate of teenage depression rises, people are looking to their political leaders to lead and guide them. I took a look at the stance of both presidential candidates, their opinions on mental health policies in the United States that would help those with mental illnesses, and on the way that political leaders of Switzerland handle these issues and actions they implement. To begin, I will discuss the ways in which mental health issues have become more normalized through media and through universities and schools. Following that, I will detail the politicians who have taken a stance on mental health awareness, their stance and their plans in the US and in Switzerland. And to conclude, I will analyze the mental health policies in the US versus Switzerland and if they're beneficial or negatively affect the public. In years past, it used to be taboo or weird to discuss therapy or any sort of issue with one's mental health. However, in more recent years, it has become a more popular subject among media, schools, and of the general public. Specifically in TV shows, it has become a new way to offer a more relatable and safe space to their audience. For example, in the show One Day at a Time, produced by Netflix in 2018, they display the character Penelope Alvarez, who suffers from depression, anxiety, and PTSD. In this particular episode, in season 3, episode 9, she details her experience about living with these illnesses and why she is so nervous to be open about them to her children. What? Okay. In this particular episode, in season 3, episode 9, she details her experience about living with these illnesses and why she is so nervous to open up about her struggles to her children, which leads her to hide her therapy from them. Typically, parents are seen as strong and unbreakable figures, which makes her experience in being so vulnerable with their children that much harder. However, by the end of the episode, her children are able to recognize that it is okay to struggle and that they don't have to go through these obstacles alone, while supporting their mother on her journey of recovery. This display of a positive outlook on mental health helps pave the way for a more accepting society. Similarly, many universities have recently been offering a variety of mental health services to support their students. In this case, I wanted to use my very own school, Montclair State University. As a freshman, I have been told many times about the different types of services offered, such as teletalk, group therapy, online self-help therapy, and individual counseling. Several of my own professors have stated many times where to find help and the information to look out for. My professors are very accommodating of the circumstances of which we are all experiencing and recognize that many students have underlying issues that can halt our schoolwork. The ways in which mental health is becoming a more comfortable subject for people to view on television and for schools to take a step in helping their students aids to the normalization of mental illness such as anxiety and depression. As the topic of mental health becomes more normalized, people are hoping for their leaders to help and guide them on a beneficial path to a healthier mental state. Lawmakers and politicians are ultimately the ones that will determine the state of their citizens with issues with mental health. Therefore, the way important political figures view the subject are Okay, let's redo that. Lawmakers and politicians are ultimately the ones that will determine the state of their citizens with these issues with mental health. Therefore, the way important political figures view the subject are dire. Taking a look at Joe Biden's outlook on mental health, he believes that as a society, we need to eliminate the stigma felt by those who are suffering and struggling with their mental health. In an interview, he stated that he believes in accelerating the deployment of telehealth for mental health and specialty care. On the opposite, Republican Donald Trump has previously stated in a briefing of the White House Mental Health Summit from 2019 that his administration is committed to helping Americans suffering from mental illness. He states that his administration is focused on early detection and evidence-based programs. As we look at the stance of certain political figures, opinion can only do so much. Looking at Joe Biden as the vice president, he championed efforts to implement the Paul Weston and Pete Domenici Mental Health Parity and Addiction Equity Act, and he was very proud that Obamacare defined mental health treatment as an essential health benefit. As a future president, he aspires to redouble the efforts of Obamacare to ensure enforcement of mental health parity laws and expand funding for mental health services. On the opposite side, President Trump's stance on the issues of mental health have varied and often lacked a clear plan for improvement for American citizens. In regards to the closure of several mental health institutions in the 1960s, he has stated that we must give major consideration to building new institutions. Trump has also made comments on how there should be an expansion of psychiatric inpatient hospitals, which is the opposite of federal law, and the Supreme Court ruling on the Olmstead decision that ruled against unjustified segregation of disabled people. Aside from America, in regards to actual action and benefits that help people, in Switzerland, care for mental illnesses is covered by mandatory health insurances if provided by certain physicians and certain psychiatrics. Although not all psychiatric care is embedded into primary care, it still plays a significant role in their healthcare system. Starting in 2018, the National Strategy for Prevention of Non-Communicable Diseases and the National Strategy on Addiction and Mental Health have focused on health equity. In Switzerland, they are providing accessible and more affordable healthcare in all aspects. The inclusivity in this country is something to be admired. Ensuring quality care for all of their patients while being affordable, it's something that Americans would be so envious of. As we have discussed, the ways in which mental health is politicized and viewed are changing. As the subject of anxiety, depression, and more become less and less taboo through media and general culture, it normalizes this life for the public. As politicians recognize their influence on society's mental health, they offer their outlooks. With action and policy, we see the ways in which they help or the ways they have failed us. In this time, in the U.S. culture, there is a clear chance to see who will be able to benefit us in all aspects, including improving our healthcare system. The time is now to recognize that mental health is more important now than ever before. As we have learned through each different aspect of mental health care, it goes to show how different our lives are and how they could be. We value proper mental health services and aspire to see real policy and action taken in order to improve our qualities of living. As we learned with Isabel, that accessibility in the two countries for mental health services are very different. And with Aiyana, the way mental health is handled in the school systems, and with Akilah about how mental health is perceived in each country within different communities, and with my own part on how politicians are determining the future of our mental health services. We believe that to be educated on the ways on the way two different political climates function regarding mental health is essential in improving our own lives. In order to help each of us and society as a whole, we must recognize our country's faults and create new ideas and elect people that will aid in improving the quality of living in our country. My first question is for Isabel. Which country do you believe that it is easier to gain affordable and accessible healthcare, the US or Switzerland?
Thank you, Claudia, for your question. So which country would I consider the most affordable and most accessible for mental health care services? For the affordability, I would have to give that to Switzerland. Switzerland is not using healthcare as a business and is trying to have all their citizens be able to financially support themselves with the healthcare. Meanwhile, for accessibility, I would like to say Switzerland. However, because since each citizen has the right for mental health care and has nothing stopping them from going to see these doctors, going to go get those visits, that means longer wait times, which is actually a very big problem with countries who have universal health care. Because of the longer wait times, citizens and patients could be waiting weeks or even months to book an appointment with their healthcare providers. Meanwhile, in the U.S., because there are a lot of citizens who are not using healthcare services, the wait times are much shorter. So you can call in an appointment and have it be able to see your provider by the end of the week. Meanwhile, in Switzerland, it could be months, and that's because of the concentration of people who are using their mental health care rights.
My question for Aiyana is what policies and any sort of action are schools taking in the US and in Switzerland regarding mental health services?
On March 3rd, 2015, the Mental Health in Schools Act was introduced to modify the Public Health Service Act of 1944. This act was instituted as a process to give grants for research and qualified public health efforts. The MHSA has had a positive impact on childhood mental health and has done a significant job by widening the gap in available mental health services for children. If you look at the purpose of the MHSA, you will see increased funding for and expand of existing programming in order to provide greater access. Secondly, provide for comprehensive staff development for school and community service personnel. And third, provide comprehensive training for parents, siblings, and other family members of children with mental health disorders.
My question for Akilah is, do you think the stigma around mental health is changing in the US and in Switzerland?
Although Switzerland and the United States are two of the world's most wealthiest countries, I believe that Switzerland takes on mental health much more serious than the United States, only for the fact that in Switzerland it's mandatory for citizens to have universal health insurance.